Hello, I'm Elisa Zhang, and I'm a physician and life coach. Today, the subject is self-care. So how many times have you gone to work when you were sick and really just not feeling well? As doctors, for those of you in my audience who are doctors, in residency, we're kind of trained, unless you're dying, you're going in. You go in to work unless you are sent home. And finding time off to go to the doctor can actually be really difficult, even for scheduled appointments. But really, this is what we tell our patients to do all the time. And so are we really taking care of ourselves? What does self-care look like to you? Some people talk about getting massages and pedicures, and I'm by no means saying not to do that. But, there's a really basic level of self-care that I think a lot of us don't really give to ourselves or think about. And one of those is just calling off when we're sick. We think, oh, there's so many patients scheduled. Then they'll have to see someone else, or when I'm going to reschedule them, I'm already overbooked every day. It's just going to make life worse when I get back. But we have to take care of ourselves. Other things like getting 7 to 8 hours of sleep a day. Sometimes when we're really busy, sleep is just the first thing to go. But if we don't sleep well, then we're not thinking well when we're awake, and we're not processing as well. And, lack of sleep actually causes death. They've done studies where they put rats on floating water, and every time they fell asleep, the rats got dunked in the water, so they woke up, and those rats actually died. So sleep is super important, and I think we all know that to some extent, but how many of us are actually getting 7 to 8 hours of sleep every night? What about eating healthy meals? A lot of times when we're really busy, like we may not even get lunch, and we're just grabbing some bar or grabbing candy just to keep us energized or motivated, or just to keep the hunger at bay. But we tell our patients all the time to eat healthy and how important that is. And how much are we doing that? Now, some of us are great at doing that. But these are just things that I've kind of picked out that a lot of us aren't necessarily being mindful of. Or we think about eating healthy, and sometimes we do it, but when push comes to shove, it's one of the first things to go. And what about the most basic, just drinking water? How many times have we gone through an entire morning without drinking any water at all? Especially right now, while I'm recording this, it's still the COVID pandemic, and at least I'm still wearing a mask every day in clinic, and I think most physicians are. And when you're wearing a mask, it even adds another barrier to just taking a quick sip of water, because you have to pull down that mask. It may not seem like a lot, but I realize that I myself have been drinking a lot less water because of wearing that mask, that I'll only drink water when I actually go back to my office, now that I finally have an office. And then just regular activity and movement. And I'm not even talking regular exercise, right? But the walking around we do in clinic usually doesn't really amount to much. On a good day, for me, it might be 2,500 steps. Now, maybe if you're in the hospital, you're getting a lot more steps. I remember when I was a fellow and was actually in the hospital and the inpatient seeing consults, I got a lot more steps. But for some of us in outpatient practice, or depending on our specialty, like I'm sure radiology and pathology doesn't get many steps either, but just taking some time out of the day to just do some movement. I mean, even for like 2 minutes, every 2 hours, right? 1 minute an hour is not very much, but I bet we're not even doing that most of the time, unless we're just, again, going to another room to see another patient. And again, this applies to you even if you're not a physician. If you're, in corporate job, in an office, meeting after meeting, or maybe even Zoom meeting after Zoom meeting, maybe you don't ever even, get up from your desk, but just taking some time to do some regular movement. And then, that next level of self-care, which I think is also really important, taking regular vacations, getting that regular exercise, having date nights with your significant other, having quality time with your children, and quality time with yourself. I mean, I think these are all also kind of basic self-care that we really need to prioritize in our life. So some words of advice, treat yourself as you would your friends and your patients. So if a friend is calling you and saying, I feel this way, my head is stuffy, like, I don't really have a fever, but, my mind's clouded, I'm just so tired, do you think I should go into work? If you would tell that friend, yeah, maybe you should take a sick day, when's the last time you took a sick day? How many days have you been feeling this? Then, treat yourself as you would if someone called you, if your friend called you and gave the same symptoms that you're currently having. What would you tell them to do? Sometimes we don't love ourselves enough to tell us how to actually properly take care of ourselves. And Just remember, you can't fill someone else's cup when yours is empty. And the old analogy where, on the plane, they tell you to put on your own oxygen mask first before even the mask of your children. So if we don't take care of ourselves, then we're all going to burn out of medicine or whatever careers we're in. And what does that leave behind? What kind of productivity and what kind of care that we can give for many years to how many more patients, how many more people we can impact. So if you're having problems like getting these self-care components into your life or thinking about how to treat yourself and how to love yourself, I encourage you to come work with me. You can sign up for a discovery consult, which is totally free, at my website, www.growyourwealthymindset.com, or just growyourwealthymindset.com. Don't even need that www. I would love to talk to you. Just imagine a life where you're actually eating healthy meals regularly, where you do take a minute or two out of every hour to do some physical activity, even that's just swinging your arms around or doing a couple squats. And that you're having date nights with your significant other and quality time with your family and with yourself, that you are, living a better, happier life. And that's all available to you. All right. So I wish that for you. I wish that for all my colleagues. And I know I can help you try to get there. Again, my website is growyourwealthymindset.com, because a wealthy mindset is not just about money. It's really about all these things in your life to live that happy and wealthy life.